Winter coughs and colds, along with fears around recent COVID cases, have combined to create massive queues at community testing stations. People are having to wait up to 4 hours to get a swab these days, with some giving up on the wait despite having COVID symptoms. Our cameraman, Simon Rogers, and reporter Nita Blake-Persen visited an Auckland testing station to check out the delays.
Cars snake out of the medical centre car park and right down the road at this Panmure testing station. Drivers, some sick and some escorting crook families, are bracing for the necessary nasal swab.
It's probably just a cold, but we just thought, should get checked out. There's a bit of uncertainty now about what's out there.
Because I started feeling sick, and I told my boss and he told me to come get a test.
I just feel like I've got a normal cold. But they said that I needed to come and get tested, so I've come and got tested, waiting to be tested.
I've got some mild cold symptoms and I thought it was the best thing to come. Checked in with the GP and they said that was what we should be doing.
The usual winter ills are arriving at the same time COVID cases have cropped up again in New Zealand, and that's creating a lot of unease.
I think people are getting worried. Yeah, they're getting worried. I mean, I guess the main thing to remember is the new cases are all from the quarantine hotels, not in the community. But I think because we had an increase in numbers, it's just making people worried.
Pauline Fuimaono Sanders is the operations lead at the Panmure Langemalie Clinic. They've been running since March 28th, but yesterday was their busiest day yet.
We did 191 tests yesterday, but across Auckland, we had 200s, 300s, 400s at the different testing centres. Well, when we went to level 1, the numbers dropped right off. And we had like 30, 40 in a day. And now we're doing over 150. And that's just us, and the other testing centres are doing more. It's been huge.
2 weeks ago, people were waiting between 15 and 30 minutes to get a test, but that's skyrocketed over the past week.
Yeah, wait times are varying between 2 to 4 hours. It's very sunny weather too, so we're quite conscious that people are waiting a long time and needing water, just the basics while they're waiting to get tested.
There were about a dozen staff on site here today and 6 in 2 mobile testing teams visiting quarantine hotels. With resources stretched, people are being told to be patient.
What's the time now? 12:51, so over an hour and a half.
About 2.5 hours. Yeah, I didn't quite understand how long it would take.
And I've been here for about an hour and a quarter.
About an hour and a half.
And most are prepared for the wait.
When I spoke to my GP, they said it would be about 2 hours. So I came prepared with food and magazines.
Is the wait deterring you?
It is, but we've waited this long, so we'll just stick with it now. Yeah.
Well, I did bring a book, which was a very good thing, and I've been reading, waiting in the queue.
3 hours now. Longer than you expected? Yeah, way longer.
But some don't have time or patience to spare.
In the hour and a half I've been here, I've seen about probably 15 cars leave. So I actually was wondering how long before someone would come and start asking questions about wait times. If they want everyone to be tested, then they probably need better access.
Director General of Health Dr Ashley Bloomfield today reiterated there was no community transmission of COVID.
We've seen an increase in people presenting for testing, partly because we are going into winter, so more people have respiratory symptoms, but also I think the awareness over the last week. Then we will be doing the testing of everybody twice in managed isolation facilities, and we are seeing the number of people in those facilities grow. And we will be doing surveillance testing of people working in those facilities and at the border. So there will be thousands of tests being done every day, and we can do up to 12,000 or just over 12,000 if necessary.
And he backed the current testing setup. Yesterday, there were 4,303 tests completed at laboratories around the country. Today, the Minister of Health, David Clark, announced a new COVID testing strategy, ramping up checks at the border. He's also confirmed anyone presenting to primary or secondary care with COVID symptoms will be offered testing, even if they have no history of international travel or contact with travellers. And he says the Ministry of Health will rigorously monitor testing rates and conduct a weekly review of testing by each DHB and by ethnic group. Mō te hōtaka o te ahiahi nei, ko Nita Blake-Persen, aho.